Chapter 3: The Aims of Psychotherapy. It is generally agreed today that neuroses are functional psychic disturbances and are to be cured by psychic methods of treatment. But when we come to the questions of the formation of the neurosis and of the basic principles of therapy, all agreement ends, and we have to acknowledge that we have as yet no fully satisfactory conception of the nature of the neurosis, nor of the principles of treatment. While it is true that two trends or schools of thought have gained a special hearing, their teachings by no means exhaust the numerous divergent opinions that have come to be expressed in our time. There are also many non-partisans who, amid the general conflict of opinion, have formulated their own views. If, therefore, we sought to paint a comprehensive picture of the situation, we should have to match upon our palette the subtle color gradations of the rainbow. I would gladly paint such a picture if it lay in my power, for I have always felt the need of comparing the numerous viewpoints. I have never succeeded in the long run in not giving divergent opinions their due. Such opinions could never arise, much less secure a following, if they did not correspond to some special disposition, some special character, some fundamental psychic experience that is more or less prevalent. If we were to exclude such opinions as simply wrong and worthless, we should be rejecting this particular disposition or this particular experience as a misinterpretation. That is, we should be doing violence to our own empirical material. The wide approval which greeted Freud's explanation of the neuroses in terms of sexual causation, and his view that the happenings in the psyche turn essentially upon infantile pleasure and its satisfaction, should be instructive to the psychologist. It shows him that this manner of thinking and feeling coincides with a relatively widespread tendency or spiritual current which, quite apart from Freud's theory, has appeared in other places, in other circumstances, in various minds, and in different forms. I should call it a manifestation of the collective psyche. Let me point first to the works of Havlik Ellis and Auguste Forel, and the contributors to Anthropophatia, also to the attitude to sexuality in Anglo-Saxon countries during the post-Victorian period, as well as to the widespread discussion of sexual matters in general literature, which had already set in with the French realists. Freud is one of the exponents of a present-day psychic predisposition that has a special history of its own. But for obvious reasons, we cannot go into that history here. The approbation which Adler, no less than Freud, has met with on both sides of the ocean permits the same inference. It is undeniable that a great many people find satisfaction in explaining their troubles in terms of an urge to power arising from a sense of inferiority. Nor can it be disputed that this view accounts for actual psychic happenings which are not given their due in the Freudian system. I need hardly mention in detail the forces of the collective psyche and the social factors which underlie the Adlerian view and call for precisely this theoretical formulation. These matters are sufficiently obvious. It would be an unpardonable error to overlook the element of truth in both the Freudian and Adlerian viewpoints. But it would be no less unpardonable to take either of them as the sole truth. Both truths correspond to psychic realities. There are actual cases which, in the main, are best described and explained by one or other of the two theories. I can accuse neither of these investigators of error. On the contrary, I try to apply both hypotheses as far as possible, because I fully accept their relative validity. It would certainly have never occurred to me to depart from Freud's path if I had not stumbled upon facts which forced me to modify his theory. And the same is true of my relation to the Adlerian viewpoint. It seems hardly necessary to add that I hold the truth of my own views to be equally relative and regard myself also as the exponent of a certain predisposition. It is in applied psychology, if anywhere, that today we should be modest and grant validity to a number of apparently contradictory opinions. For we are still far from having anything like a thorough knowledge of the human psyche, that most challenging field of scientific inquiry. For the present, we have merely more or less plausible opinions that defy reconciliation. When, therefore, I undertake to present my views in a general way, I hope I shall not be misunderstood. I am not recommending a novel truth. Still less am I heralding an ultimate gospel. I can speak only of attempts to throw light upon psychic facts that are obscure to me, or of efforts to overcome therapeutic difficulties. And it is just with this last question that I should like to begin, since it is here that we find the most pressing need for modifications. As is well known, one can get along for quite a time with an inadequate theory, but not with inadequate therapeutic methods. In my psychotherapeutic practice, covering nearly 30 years, I have met with a fair number of failures which were far more impressive to me than my successes. Almost anybody, from the primitive medicine man and the prayer healer up, can gain successes in psychotherapy. But the psychotherapist learns little or nothing from his successes. They mainly confirm him in his mistakes, while his failures, on the other hand, are priceless experiences in that they not only open up the way to a deeper truth, but force him to change his views and methods. I certainly recognize how much my work has been furthered by Freud and then by Adler. And whenever possible, I apply their standpoints to my practical treatment of patients. Nevertheless, I insist upon the fact that I have met with failures which I feel could have been avoided had I taken into consideration those empirical data which later forced me into modifications of their views. It is impossible to describe all the situations with which I was confronted, and I must content myself with singling out a few typical cases. It was with older patients that I had the greatest difficulties, that is, with persons over 40. In handling younger people, I generally find the familiar viewpoints of Freud and Adler applicable enough, for they offer a treatment which brings the patient to a certain level of adaptation and normality, apparently without leaving any disturbing after effects. With older people, according to my experience, this is often not the case. It seems to me that the elements of the psyche undergo in the course of life a very marked change, so much so that we may distinguish between a psychology of the morning of life and a psychology of its afternoon. As a rule, the life of a young person is characterized by a general unfolding and a striving towards concrete ends. His neurosis, if he develops one, can be traced to his hesitation or his shrinking back from this necessity. But the life of an older person is marked by a contraction of forces, by the affirmation of what has been achieved and the curtailment of further growth. His neurosis comes mainly from his clinging to a youthful attitude which is now out of season. Just as the youthful neurotic is afraid of life, so the older one shrinks back from death. What was a normal goal for the young man inevitably becomes a neurotic hindrance to the older person. In the case of the young neurotic, what was once a normal dependence on his parents inevitably becomes, through his hesitation to face the world, an incest relation which is inimical to life. It must be remembered that, despite all similarities, resistance, repression, transference, guiding fictions, and so forth, have one meaning when we find them in young people, while in older persons they have quite another. The aims of therapy should undoubtedly be modified to meet this fact. The age of the patient seems to me, therefore, a most important indicium. But there are also various indicia which we should note within the period of youth itself. Thus, according to my view, it is a blunder in technique to treat from the Freudian standpoint a patient of the type to whom the Adlerian psychology applies. That is, an unsuccessful person with an infantile need for self-assertion. Conversely, it would be a gross error to force the Adlerian viewpoint upon a successful man whose motives can be understood in terms of the pleasure principle.